I say data, what do you think of? Or rather, who do you think of? You probably think of people like me, or people like you. We think of Talend and Google, Facebook and Apple. We think of high tech and big business. But that's definitely not the full story, because data can not only help make business decisions, it can help us make great social decisions. Charles Stiles was an American scientist born in upstate New York in 1867. He studied medicine at some of the best universities. In 1902, he took a position in Washington, D.C., and was surprised at the relatively poor performance of students in the American South. Students were often years behind their northern counterparts and suffered inexplicably high rates of absenteeism. As a doctor and a scientist, he started looking into a few local cases and found that a number of young people were infected with hookworm. It's a disease that can enter the body through the feet while children were playing outside, and it can cause extreme levels of anemia. He cured the disease in these cases and helped a few failing students turn things around. But he had a sneaking suspicion that this wasn't a localized issue. So he petitioned the famous industrialist John D. Rockefeller and got him to sponsor a massive data collection program. The Rockefeller Commission performed studies on children across 600 counties all across the South. What they found was jaw-dropping. Over 40% of children had hookworm infections. With this data in hand, a massive eradication followed. And in a matter of months, thousands of lives were turned around. Today, we're talking to Ann Holder, the founder and CEO of Odonata Health, about how she is using data to take maternal and prenatal care to people and communities where it was previously inaccessible. It's a really inspiring story and a great example of decision-making and how data can lead to better social outcomes. So without further ado, let's get into it. Welcome to Truth Be Known. Welcome everybody to another episode of Truth Be Known. We have an incredible guest today, Ann Holder. Ann, do you want to jump in and introduce yourself?
Sure. I'm Ann Holder. I'm the CEO of Odonata Health. We are focused on bringing to the market a new technology for non-invasive fetal monitoring that can be used in the home and hospitals.
That's incredible. I would love to jump right in. So why did you start your business? What are you most excited about right now?
Well, it is a little bit of a long story. So my background is pretty heavy in technology. I started as an engineer after I got out of the military, and I ended up in different roles in engineering and operations, and then wanted to get into a role where I could drive revenue, and ended up in telecom, from food manufacturing to telecom, but eventually ended up in medical devices and worked for Medtronic, which is a global leader in medical technology. And through that company, I just built a lot of relationships with some pretty well-known physicians and are technology leaders in their rights. And Dr. Paul Friedman, who is at the Mayo Clinic, he's a chief of cardiology. He's also an electrophysiologist. So an electrophysiologist is a cardiologist that really focuses on the electrical activity in the heart, and working on disease states for that area. And he had an idea, he and his team, and he's got some pretty amazing physicians and engineers around him, had an idea to utilize some of the technology development that they were doing around AI and machine learning in cardiology. And they actually started doing some research where they could actually determine the early onset of diseases in cardiology by assessing the signal morphology of an ECG signal. So our idea was to do the same thing for a fetal signal. So that's really how the whole thing started, in just working with them. It was based on some ideas that we had. The biggest issue that we had was, how do you capture an ECG of a fetus?
Mhm.
And really, the only way to do it where you get a clean signal today is literally screwing an electrode into the scalp of the baby's head after the water's broken. And they do it in about
Mm.
25% of the babies that are being born. But there's risks associated with it, infection, transmitting a disease
Yeah.
to the baby if the mother has the disease. So it's really the best way to get an ECG, but you can't do that all the time. So we just started digging into research that had been done in the area of capturing fetal ECGs. And all of this really led to the founding of the company. And that's how we got started.
And that's amazing. And what have you seen with some of the patients that you have and some of the fetal monitoring? What's the impact that it's had on healthcare?
Well, so we are still in the really early stages of development right now. What the signals that we're capturing are pretty amazing. So, what we're doing is we're going to be creating a whole new technology that can be utilized in fetal monitoring. So, right now, if
Mhm.
you look at what the standard of care for fetal monitoring is, technology that was based on devices that were developed in the 1960s. And it's CTG equipment. And it's
Mhm.
basically utilizing Doppler signals or acoustic signals to listen to the baby's heart rate, or they use a mechanical diaphragm essentially to capture contractions. Well, those
Mhm.
technologies were developed in the 1920s. That's how old they are. And there has not been any advancement in technology. So that's really kind of where our focus is developing this new technology so that we can give doctors a lot more information. So if you think about it, if you end up in the emergency room, or if you're having surgery, or if you end up in an ICU, you always see an ECG.
Mhm.
It's standard of care. But here we have these precious little babies that are being born, yet we don't have standard of care for them. So that's really what we're trying to develop, is just develop what is standard of care for all of us, to develop that for labor and delivery, but then also for prenatal care as well.
Yeah. I mean, that's going to it has the potential to have a huge impact on women's health care, on prenatal care, on the care of babies being born.
Right. That's where our focus is, and that's where our hope is. Now, Um, the thing that we are doing to make it easier for physicians to give them better data is to develop algorithms um, and machine learning to actually assess those signals, so that the doctors actually have better information, because some of those signals are hard to read. So if we
Mhm.
can actually develop these algorithms based on massive data sets that we have access to with outcomes, we believe that it's a game changer for standard of care in the future.
It absolutely is, and it just goes to showcase and highlight the power of data and the power of really being able to understand your data and what better decisions you'll have doctors and nurses and even parents being able to make because of it. How do you see, even beyond this, how do you see women's health and children's health being improved by all of this?
So, one of the reasons why I really took a huge interest in kind of entering into this endeavor was looking at the C-section rates. So the
Mm.
U.S. has some of the worst maternal morbidity and mortality rates in the world. So we're number 8
Mhm.
in the entire world for having the worst outcomes. Some of those outcomes are actually due to C-sections and complications that come from C-sections. And we've got right now, our C-section rate is 2 times what the World Health Organization actually recognizes as what the standard should be. We do too
Mm.
many C-sections, but part of the problem is physicians don't have a lot of information. And so, they're making decisions based on fetal heart rate and variability in the heart rate during labor. So that's really what we were trying to get at, is like, how do we give them more information that the fetus is okay? And that's where an ECG can actually play a large role and give them a lot more information. So around 80% of the C-sections that are done today are not necessary, but there's just not enough information. So you get a decelerated heart rate with contractions and it doesn't come back up. You don't know, is the baby just relaxed and sleeping, or is there a complication, and is the baby lacking oxygen? So that's really what we're trying to do. We're trying to improve the standard of care and give them more information to ultimately improve outcomes. And then another outcome of that is a significant decrease in the cost of care as well.
That's incredible. And so much of it for me shows if we don't have the right information, or if we have what we think is the right information, we think we have the right data, but we don't really have context, it's not complete. People are unfortunately making decisions that are putting the lives of women and the lives of babies at risk. And it's in a lot of ways through no fault of their own. This is the data that they have. This is the information that they have. They're making the best decisions they can. But imagine what you can do if you really understood, to your point, the baby just started chilling, waiting for things to happen, or is there really a problem? And it's a completely different next step. It's a completely different decision-making process that has to happen.
Exactly.
So not doing anything, important for the world, just hanging out. So I would love to change topics a little bit, and just really keep pushing down the lines of these decisions, because it makes me think a lot about the hard decisions doctors are making every day, and nurses are making every day, and parents are making. And then as the CEO, I could only imagine you yourself are faced with incredibly hard decisions every single day. You were building a business. I'd love to talk about what's one of the hardest decisions you've had to make.
Well, so quite honestly, one of the things that was pretty significant for us, especially in this early stage of this company, was we have this pretty amazing technology that we're working on right now. And part of our product strategy was to really focus on, let's get this technology in the hands of OBGYNs in the hospital, where they can use it. We build some credibility for our technology. They use it in labor and delivery. They learn to trust it, and then transition to utilizing that technology in the home to try and make it easier to manage patients remotely, increase patient satisfaction. You can possibly manage them more often, have more check-ins, capture data. And it was really interesting in the beginning, and this was a couple of years ago, I had physicians that were like, love it, want to use it in labor and delivery, keep us updated on your progress. And then I talk about telehealth, and they're like, absolutely not. I need to see my patients, not interested in telehealth and telemonitoring. But then there were some physicians that was like, oh my gosh, if I could take my high risk patients and actually just significantly increase the number of times that we're connecting with them, and I can get some data from the home, I can do testing in the home, how great would that be? So it was really interesting. There was definitely a divide of opinions between the folks that wanted it in the home and the folks that only wanted it in the hospital. And then COVID happened. So we then started focusing on, okay, so what do we do in this situation where there's a massive need right now to do prenatal care and capture the same data that they capture in the clinic? How do we do that in the home? And I don't know, there's just so much out there right now on prenatal care and what's happening due to COVID. Women are not going into the homes or into the clinics for their appointments. They're missing some testing that needs to be done, particularly if they're high-risk patients. And prenatal care is just, it's not happening. In fact, I was talking to an OBGYN that was telling me that the number of non-stress tests for high-risk patients has gone down considerably. The number of stillbirths has gone up considerably with COVID. So we had to make a pretty significant change in our strategy. And it was difficult for me as the CEO of the company, because we had done a lot of fundraising based on this technology for use in labor and delivery, and then looking at telehealth in the future. We literally had to change and accelerate our telehealth business, and put a lot more money into developing the technology so that we can actually do prenatal care in the home. So from the time a mother finds out that she's pregnant all the way through when she has the baby, providing a really robust platform with technology so that you can do prenatal care in the home. So for us, it was a pretty significant change. And a lot of discussion that we had to have, and we had to look at, how do we fund it, and how do we get the right technology team around it so that we can get it to market as quickly as we can.
So because that was really interesting. Actually, one thing that you had talked about reminds me a little bit of something one of our previous guests had said. We had a founder, Craig Swensard, on Truth Be Known recently, and he was talking about with his company, one of the companies that he had started, he started the business, decided to build one strategy, and then talked to 10 customers, and it turned out they got it wrong, and they pivoted the whole company and said, this is the direction we think we should go. And it ended up being a really successful company and choice. And I think about the decision you had to make of, you're starting out thinking labor and delivery. Now there's this whole telehealth and telemedicine piece, and it's a big decision and changing strategy. And even though you have all of these indicators that say this is the right angle to go, it's a hard call to go in and want to change, and have the courage and conviction to change the initial plan. For you, was there an inciting event? What was your decision-making process when deciding to make the pivot?
It was talking to some of the physicians. They, like I said earlier, it was kind of a split population when we were doing our market research in the beginning, whether telehealth was something that would be beneficial, would we get market penetration? It was, so we knew it was something we wanted to do, but just because our future customers were so divided on it, we were going in labor and delivery first, specifically because we really wanted to get our technology in their hands so that they could use it. When COVID hit, we had, some of these same conversations with these physicians, and I'll never forget, I was talking to one who was we have a strong partnership with his organization, and he was not interested in telehealth. And we were on a call, and he started laughing. He's like, Anne, I know what I told you about telehealth. And he said, I've just done a 180. I have to completely look at this differently and, reconsider. Well, he wasn't the only one that said that. A lot of people are, changing their own strategy and their practice strategy around telehealth. And for me, it was, that was pretty telling. And then quite honestly, just a side note, I mean, we were right in the height of COVID, late spring, everything's still locked down. We drove way up north. I'm in Minnesota. We drove way up north to pick up a puppy. And it was a husband and wife, and they had 2 kids, and she was very pregnant with her 3rd baby. And so I started talking to her about her pregnancy, and I was telling her what I was doing. And they live in a very remote location. And she's a nurse, so she was comfortable with everything that was going on with her pregnancy, and it wasn't her first pregnancy. But she was around 28, 29 weeks pregnant. She had only had one in-person visit with her physician, just one. And the rest of her appointments were phone calls from her doctor asking how she felt and if she felt the baby moving. Those were her appointments. So I started, we kind of were looking at all of these things that are going on. It was a change in sentiment around the physicians and their acceptance of telehealth. And then it was also looking at what is going on with our patients. And even, when it's not COVID.
I've heard this so many times from CEOs, from CIOs, from honestly every leader, is how much COVID has accelerated changes and changed the way the way businesses operate, the way we all operate. And just listening to you talk about this, thinking there's a there's a woman who's seen her doctor in person once at 29 weeks, and it's, are you doing okay, is so different. And it is because we live in a world where you're not seeing people every day, and you are not, if you want to actually see your doctor in person, you really need to think about why really does accelerate this need for telehealth. And then what's going to make it even more effective is, what's the data that you're getting? How are you pulling in the right information? And can you get the doctor real information and as much information as possible to make everything as safe as possible and to provide the best quality care for patients? So it is almost an accelerator. And I think it sounds like from everything you're saying, having this and making this shift, the shift to telehealth probably would have happened eventually, but it is just sped up exponentially.
Exactly. And that's exactly what's happened. And it's not, it's not even just for prenatal care. It's across the board. It's for pediatric care. It's for general visits. It's accelerated a huge leap in technology that would have taken several years to get through. And you stop and think about even just reimbursement from a payer perspective, whether it's the government or commercial payers, the insurance companies, they're actually even more supportive of covering these costs now. And quite honestly, I don't think it's going to go back. I think if there was some pushback on paying for telehealth in the future, I don't think we're going back. I don't think that patients and the general public would support that. So I do think it's here to stay.
I think you're 100% right. And what this has shown us is, I mean, do you remember waking up in the middle of the night going, I don't feel well. I need to see a doctor. I don't need to go to the emergency room. Okay, I'll wait all night. I'll get up in the morning. I'll drag my sick self to an urgent care. I'm going to sit in a room infecting all of these other people because I'm unwell. And telehealth says you don't have to do that. If you wake up in the middle of the night and you don't feel well, you can have a video chat with the doctor and say, it helped me understand why I don't feel well. And they'll say, you know what? I think you just have bad food poisoning. And it's just getting that immediate care. I don't think people are going to want to, you're 100% right. People aren't going to want to go back from. And once you have the ability for people to monitor their own health at home to a greater degree, monitor the health of their baby at home to a greater degree. So the data points that doctors and physicians and nurses might be missing that warrant an in-person visit, we're coming up with new ways faster and faster to transmit that information. So you're, in a lot of ways, can get better care faster. And if you're in a rural location, you can access the best doctors around the world, regardless of where you're sitting.
Exactly. I mean, that's where the power of this all lies right now. There's no reason why we can't be doing that. There's no reason why it can't be standard of care.
And at the end of the day, it will make us all healthier. And again, you're not doing anything major. You're just saving lives of babies and women around the US and the world.
That's what our hope is. That's what our goal is. And our, from a mission perspective, we are all focused on that internally, is just to improve outcomes. And really in this area of prenatal care and bringing technology in for that care, as well as in labor and delivery, it has to change. So that's our focus.
Awesome. That's incredible. And I know you've had a long career and a long history before you. Can you tell me a little bit about, in all of the different roles that you have had, is there another really challenging decision that you've had to think through in past roles and past lives?
Yeah. So, I've had in my career, I was in food manufacturing before I got involved in medical devices. Started off in engineering, as I mentioned before. And then I spent a lot of time in operations and running food manufacturing operations for really large companies. And it's when you're in a position and you've got responsibility for really tough decisions that could be very costly decisions. They, they're tough in the fact that your decisions will cost a lot of money, but in the end, the decisions are relatively easy, especially like in food manufacturing. If there is contamination or even a slight chance for contamination, whether it's a dairy product, and sometimes those are even more difficult, and you have to be so careful. Having to say, okay, we ran production for 8 hours, and we don't know what exactly the quality is of that product. And it could just be a very, very slight risk, but you have to make that call that product is not saleable. So those are some of the things that, in the past where you have to make these decisions, and whether it's medical technology or food, quality is one of those things that is near and dear to my heart. And you just have to focus on making that harder decision, or not harder decision, making the right decision. Even though from an economic perspective, it's hard. But just taking care of your end customers is really paramount.
It really is. And then I would love to keep talking to you all day about some of the incredible work that you've done, but I think it's time for our rapid fire questions. I don't think you've gotten these in advance, so these are meant to be quick hits. You ready?
No, I'm ready.
All right. So, what habit or hobby have you picked up during shelter in place?
Actually, I have been taking better care of myself, which is interesting, but I have been making time for myself to exercise. So whether it's just getting outside for a long, brisk walk with my dogs and my husband, or getting on the treadmill, depending on what time of year it is. Again, I'm in Minnesota, so if it's minus 20 outside, I'm on the treadmill, but just exercise is my habit right now. And I find it really kind of clears my head. And if I don't exercise, people around me notice.
I think you and I are the same person with that. It is paramount. My unsolicited recommendation: I got a kettlebell during shelter in place. It is my favorite thing in the whole world.
Ah, that's a good idea.
You can do a 15 or 20-minute kettlebell workout that just completely wipes you out. And that has been my mental health since shelter in place, is 20-minute kettlebell workout. So next question, what would you be doing if you weren't a CEO?
Well, that's a really good question, because I spent so much of my career working for really large companies. if I wasn't in this role right now, from a career perspective, what would I be doing? I'd probably be starting up another company. So I don't know. I did start up another company that my husband is actually running right now, it's been great. And it's kind of fun to be, have this business that my husband and I are sharing together. But if I wasn't doing this, I would definitely be working. But quite honestly, it would definitely be in a field that is somehow focused on community and having some type of social impact.
So still saving the world.
Well, I don't know. It's kind of one of these things that, and maybe it comes from the time I spent in the military. I do have this sense of service. If I'm not helping people, I feel empty, and it's just kind of the way I'm wired, I guess.
I think the world probably needs more people like you.
I don't know about that, but I'm trying.
No, it's awesome. And then what is your favorite book or podcast that you've binged on recently?
So my favorite book that I've read recently that I loved was Educated. Phenomenal. And I don't know if you haven't read it. It's about a woman who grew up in Idaho in a very dysfunctional family, and is just a brilliant woman. It's just a great story. And then podcasts that I've binged lately, and I haven't been doing a lot. I'm trying to think. I've gotten hooked on Dan Carlin's Hardcore History.
Mm-hmm.
And I do enjoy history, and I actually learned a lot. And with my military background, there was a lot that I didn't even understand about history in World War I and World War II. So I did enjoy that. Oh, and Dolly Parton's America. I loved that one.
Oh, I keep hearing about that one.
Yeah, it's great. Really good.
And then last question, do you have any advice for a first-time CEO?
For me, I am really happy with what I'm doing. It's been incredibly fulfilling. And I talk to a lot of people that are really weighing the pros and cons of being an entrepreneur and a first-time CEO. And my advice is just to have confidence in taking a risk. Because quite honestly, if you don't, you're always going to second guess yourself. And if it doesn't work out, there's always something else. There's so many different things that we can do with our careers and our lives that you just can't worry about the future, and you just need to take that leap.
I think that is incredible advice. And thank you so much. And if people want to learn more, get more involved, learn more about Odonata Health, what's the best way for them to jump in?
So you can reach us on LinkedIn at Odonata Health. And then also there's contact information on our website, www.odonatahealth.com. It's probably the best way to get a hold of us.
Fantastic. Thank you so much for joining us.
Oh, thanks for having me.
Truth Be Known is brought to you by Talend. A leader in data integration and data integrity, Talend enables every company to find clarity amidst the chaos. Talend Data Fabric brings together in a single platform all the necessary capabilities that ensure enterprise data is complete, clean, compliant, and readily available to everyone who needs it throughout the organization. Learn more at talend.com. That's Talend.com.